Anorexia nervosa is a serious and potentially life-threatening eating disorder characterized by extreme restrictions in food intake, an intense fear of gaining weight, and a distorted body image. It primarily affects adolescents and young adults, though it can occur in people of any age, gender, or background. Key symptoms: restricted eating, consuming significantly fewer calories than the body needs, often paired with avoiding certain food groups or adhering to rigid dieting rules. Fear of weight gain, intense fear of becoming fat or gaining weight, even when underweight. Body image distortion, viewing oneself as overweight despite being significantly underweight. Weight loss, often to a degree that is unhealthy or dangerous for the person's age, height, and body type. Obsession with weight and food, spending excessive time thinking about food, calories, dieting, or body shape. Physical symptoms: extreme weight loss, fatigue, dizziness or fainting, brittle nails and hair. Dry, yellowish skin, feeling cold often even in warm environments. Menstrual irregularities or amenorrhea, loss of menstruation in women. Slow heart rate or low blood pressure, psychological and behavioral signs. Avoidance of meals or eating in public. Compulsive exercise, denial of hunger or refusal to eat. Depression, anxiety, or social withdrawal. Perfectionistic or controlling tendencies, causes and risk factors. The exact cause of anorexia nervosa is unknown, but it is believed to result from a combination of genetic, psychological, and environmental factors. Risk factors may include genetics, a family history of eating disorders, depression, or anxiety, personality traits, perfectionism, high levels of self-criticism, or low self-esteem, societal pressure, cultural emphasis on thinness and unrealistic beauty standards, trauma or stress, emotional trauma, bullying, or stressful life events. Diagnosis typically involves a combination of physical exams, psychological evaluations, and assessment of eating patterns, behaviors, and medical history. A healthcare professional may also evaluate physical complications such as malnutrition or organ damage. Treatment: anorexia nervosa requires a multidisciplinary approach, often involving nutritional rehabilitation, gradually increasing food intake and addressing malnutrition; psychotherapy, cognitive behavioral therapy (CBT), to address distorted thought patterns and behaviors related to food and body image; family-based therapy (FBT), often used for adolescents to involve the family in the recovery process; medical monitoring, managing physical health complications and monitoring vital signs; medications sometimes used to treat underlying conditions like anxiety or depression, though they are not a primary treatment for anorexia itself.